Much of my suffering, if not most of my suffering, was caused by the treatment. But it never occurred to me to question what I was being told because the people that I was seeing had letters behind their name. They were the quote unquote experts. They had degrees. And I don't necessarily fault them for what they were telling me because that's what they had been told in school. That's what they had been taught in school. And they genuinely believed what they were telling me to be true. So we were all going along with this because again, in our society, we are taught to trust the experts. We have been conditioned to believe that in order for somebody to know something, they have to have letters behind their name proving that they've been through the education system and gotten a stamp on their name and on their knowledge that says that what they are saying is true. Welcome back to the Upside of Bipolar. I am your host, Michelle Whitaker, and I have a really interesting topic today. Whenever I share the information and research that led to my healing and recovery, and that I now use to help coach other people through their own healing and recovery process, I'm regularly challenged. People want to know what my credentials are, what my degree is in. And I started, before I would, try to explain, and sometimes I still do, how I came to this knowledge and understanding. But I've started to kind of be a little bit snarky in my response. I have common sense and a brain and the ability to read research. But I feel like it would actually be beneficial to share how I came to this understanding and knowledge myself, because I don't expect anybody to take my word for it. I would love for people to go and do their own research and learn these things for themselves, because what I am sharing is not my research. I have read the research of people with degrees that has led me to the understanding that bipolar can actually be healed, that you can identify the sources of your symptoms, treat the sources using these research-based integrated treatment methods, and you can recover. And so on today's episode, I'm actually going to walk you through the process that I went through as I learned the truth for myself, and then share the resources and research that helped me to understand that it's possible to heal bipolar. When I was first diagnosed back in 1998, I was told that I had a chemical imbalance and that I would have this for the rest of my life, and that the medication was like insulin for diabetes. And it's interesting because in our society, we are so conditioned to believe the experts and trust the experts that I didn't question anything that I was being told. I just believed them. I didn't ask to see the research. I didn't ask to see the information that validated what they were telling me. I just believed what they were telling me because they had degrees. And for years, I sought psychiatric treatment that just made things worse. And over the 12 years that I was in traditional psychiatric treatment on medications, ending up in the hospital, having electroconvulsive therapy treatment done on me, I didn't understand that what was happening to me was not okay, that it wasn't helping me, that it was actually making things worse. Much of my suffering, if not most of my suffering, was caused by the treatment. But it never occurred to me to question what I was being told because the people that I was seeing had letters behind their name. They were the quote unquote experts. They had degrees. So I didn't question what they were telling me. And I don't necessarily fault them for what they were telling me because that's what they had been told in school. That's what they had been taught in school. And they genuinely believed what they were telling me to be true. So we were all going along with this because, again, in our society, we are taught to trust the experts. And we don't trust people that don't have letters behind their name. We have been conditioned to believe that in order for somebody to know something, they have to have letters behind their name proving that they've been through the education system and gotten a stamp on their name and on their knowledge that says that what they are saying is true. When I started to question, I don't know that I necessarily was questioning what I had been told, but I questioned the treatment. I could see that not only was I not getting better, I was getting worse. And I had gotten to a point of total hopelessness that led me to make multiple attempts on my life. And I've shared this before, but I had two really profound experiences that really changed things for me. The first was after my third hospitalization, when I was watching my children play one day, and I had at that point made a few attempts on my life. I was watching my children play and had a really clear thought come into my head that if I ever successfully ended my life, that I would ruin my daughter's life. She was 4 years old at the time, and I can still see her in her little golden bell dress that I had made for her that she was playing in that day. Her little curls bouncing, golden in the sunlight. I can see my little girl in my head because it was such a profound experience for me that it's etched in my memory forever. And I realized that I had to figure out a way to survive because I didn't want to ruin her life. I didn't believe my life had any value at that point, but I knew hers did. And I wanted to make sure that she had the best possible chance of a happy life that I could give her. And so if it meant me just suffering through the rest of my life, trying to survive for her, I would do it. So I did for the next year, white knuckle it. I just hung on for dear life, trying to survive, continuing with the treatment that wasn't working, but it was the only thing I knew. And then I ended up in the hospital again. And after that fourth hospitalization, I was again watching my children play one day out in the yard. And I had this thought come into my head, nobody is coming to save you. You have to find a way to save yourself. And I started to take responsibility for myself. I didn't know before that was even possible. I felt like I was. I felt like I was taking responsibility for myself by going consistently to my psychiatric appointments, taking all the medications they were giving me, going to therapy, even though it didn't do any good for me at the time, and going into the hospital when I felt like I was a danger to myself. I was doing everything that I knew that I could do, and I felt like I was taking responsibility, but I started realizing I needed to find another way to take responsibility. I needed to find a way to manage my symptoms. I needed to find a way to truly be responsible for myself, because hanging on for dear life wasn't a strategy. It wasn't working. And so from that point forward, I started looking for things to help me. I started developing the Mood Cycle Survival Guide. I found through a friend the micronutrients through True Hope. And when I first started taking them, I didn't really understand them. I didn't know much about the research. I mean, I got the research and gave it to the doctor. I didn't really understand what micronutrients did. In fact, for years, I thought you could either take medication or micronutrients. Medication worked for some, micronutrients worked for other people. Like, I didn't really even understand what micronutrients were doing for me. I was just desperately trying to find a way to manage what I believed was going to be a lifelong incurable condition. And because things had been so bad for me, even when I went through the cross titration process and went through withdrawal and over medication and med releases and all of those things that go along with, helping your brain heal from medication, I just hung on because it wasn't any worse than what I'd already been going through. And over time, my brain started to heal. I didn't know it was healing. I didn't understand what was happening. I just thought, I found something that actually helps me manage my bipolar. And then I started understanding how to use therapy, how to use it proactively to heal, not just to go and talk about my problems and be validated and cope. I actually learned about healing modalities. I learned about trauma modalities and EMDR and IFS and, all these other treatments that could actually help get to the root of my trauma and help me resolve it and heal. I started learning about mindfulness meditation, and I started becoming friends with my brain again and being able to manage my emotional responses to things. And I started understanding how to recognize the symptoms for what they were and started learning how to look for the sources of the symptoms. This was a gradual process that I kept working at it over a 12 to 15 year period. And when I started my blog back in 2020, the end of 2020, beginning of 2021, I still didn't understand bipolar. I still believed what I had been told all the way back in 1998 by my first doctor, that it was a chemical imbalance, that I would have it for the rest of my life, and that I would always need medication. And I just thought medication didn't work for me, but micronutrients did. And so when I first started my blog and I first started sharing on social media, I was still working under that assumption. And so I was very careful not to talk about healing or recovery because I didn't understand that that's what was happening. And I was still finishing up the healing process for myself. I was still going through, experiencing symptoms and still identifying sources of trauma and learning how to really practice mindfulness meditation. I was still learning how to apply these tools when I first started my blog. So I was still experiencing some symptoms at the time because I hadn't resolved all the sources of the symptoms and I didn't know I was healing. But as I started to become more informed and try to provide better information for people, I started doing more research. And I started following people online that were in a similar space, people that were talking about holistic psychiatry, which seemed like, psychiatry, but, more holistic in its approach, which felt like what I was doing. I felt like I was more holistic in my approach to psychiatry. And that was when I found a couple of people online that I started getting book recommendations. And I had my red pill moment when I read Robert Whitaker's Anatomy of an Epidemic. That was the step through the looking glass. That was when I started understanding what was really happening. And Robert Whitaker's Anatomy of an Epidemic is one of the most insightful, well-researched books I've ever read. And he does a thorough job of going through the research, the history of psychiatry, the research related to all of the different issues with all the different types of psychiatric illnesses or the main types, I should say, not all of them, but he talks about bipolar, he talks about depression, anxiety, and his book, Mad in America, talks about schizophrenia. And as I read Anatomy of an Epidemic, the first time I read it, I actually took a long time to get through it because I became so angry and I felt so betrayed as I was reading this book. What I was learning was very upsetting to me. I felt very betrayed by the people I had been turning to for treatment for 12 years. The people that had assured me that the medications, we were going to find the right combination of medications, that I needed medication, that this was going to be solved by medications. The doctors who insisted that when I needed electroconvulsive therapy, it was because my brain was like a computer that was frozen and it needed to be rebooted. The doctor that insisted that even though I had a psychotic episode when I had taken lithium the first time, that it wasn't the lithium, that it was my untreated bipolar that caused the psychosis, and that I needed to try lithium again, which was actually what led to my first suicide attempt. And this opened my mind up. When I read Robert Whitaker's book, I started looking for more information. I wanted to learn more, which is what led me to begin reading Professor Joanna Moncrieff's research. And I've had both of these people on my podcast. I had Robert Whitaker on very early. He was one of I think he was episode, I want to say 21 or 23. I'll have to link it in the show notes. I had him on. He was the first person that I approached him thinking he's probably going to say no. And I was so surprised and honored that he said yes. And when I had him on and talked to him, I started realizing there are other people out there. And that's when I started looking for more. And I read Professor Joanna Moncrieff's research, and I've had her on my podcast twice. The first book of hers that I read was A Straight Talking Introduction to Psychiatric Drugs, The Truth About How They Work and How to Come Off of Them. And when I read this book, it was the first time that I had been introduced to the idea of the disease model of psychiatry versus the drug model of psychiatry. The disease model of psychiatry is what we currently have. That is the idea that bipolar disorder, anxiety disorder, major depressive disorder, even schizophrenia are all diseases, some kind of disease in the mind, a disorder in the mind. There's an underlying disease mechanism. They just haven't found it yet, but they are working on the assumption that when they diagnose somebody with bipolar disorder, that they are diagnosing them with an underlying condition, that they believe that the diagnosis is identifying an underlying medical condition, a disease, and that the drugs are being used to treat the disease. Never mind that has never been true. They have never found, when they created, when these, and this is what I learned first in Robert Whitaker's book, and then I have learned later, that the disease model was an assumption made that validated the use of psychiatric drugs, but there was never an underlying etiology or an underlying disease identified. When they created the bipolar diagnosis, they just took a cluster of symptoms. There were psychiatrists that got together and voted on the criteria and then created this category based on the criteria that all these doctors came up with together based on clusters of symptoms that they agreed on. And then when people wouldn't fit within those clusters, as the DSM, so we have the DSM-5 now, there was a DSM 1, 2, 3, 4, 5. Each time they come out with a new DSM, it gets bigger because they identified more diseases, they say, and they change the parameters of the disease. The diagnosis, the parameters of the diagnosis, the diagnostic criterion get changed based on what the doctors see in their clinics. And they decide, oh, well, we need to make sure that these people aren't fitting into a category, so we need to expand the parameters of this category or create a new category. And they keep trying to justify the disorder category by doing research to look for an underlying condition. But they didn't identify an underlying condition in the first place. They just created a diagnosis based on a cluster of symptoms. And I've used this analogy before, but I keep using it because it's such an apt analogy. It would be like somebody who's running a fever coming into the doctor and being diagnosed with fever disorder. Fevers have all kinds of different sources. You could be running a fever because you have strep throat. You can be running a fever because you've been out in the sun all day. You can be running a fever for all kinds of reasons. But the name fever disorder does not tell you what the source of your fever is. It doesn't identify what's causing the fever. It just observes the symptom. And so when I read Professor Joanna Moncrieff's book, she talks about this disease model that is driving psychiatry and justifying the use of psychiatric drugs that we don't fully understand. When they test these drugs, they don't test them for long-term use. None of these drugs have been tested for long-term safety. They are tested usually for about 8 weeks. And the long-term, quote-unquote, long-term studies that have been done are just taking people off of drugs to see what happens. And one of the studies that was done was taking people off of lithium. And they don't withdraw them in a safe way. They just remove the drug. And when they become manic again, then they say, oh, yes, see, there's a recurrence of the disease. Because, again, the symptom itself is identified as a disease. Nobody acknowledges that it was caused by the withdrawal of the drug. And so they say, see, the drug is working. We need to keep them on the drug. That's it. They have not done long-term testing, and there is no acknowledgement that the long-term consequences of taking these medications are directly related to the drug and what the drug is doing to the brain and the body. When she talks about the drug model, she talks about how there are people who prefer the drugged state. So it is acknowledging that the drug is not actually treating a disease, but that the drug is suppressing symptoms that the person doesn't like, and that the person prefers the drugged state to the non-drugged state. This was really eye-opening to me. And she talks about also how it used to be a couple decades ago that people who were practicing psychotherapy or therapists would not treat somebody who was on medication because they understood that when somebody was in the drugged state, that their brains could not process emotion in a healthy way, so they wouldn't treat them because it wasn't going to work. The therapy wasn't going to help because the person couldn't process the emotions. So they didn't used to allow people to go or take patients that were on medication. Now the psychiatric industry has become so completely taken over by this disease model mentality that psychiatrists or therapists will see people who are on medication all the time. And I had lots of therapists who talked about how therapy is for learning how to cope, because they bought into this idea that bipolar was a lifelong incurable condition, and they were just going to try and help people cope with the things that they were struggling with, rather than helping them to actually get to the source of their symptoms and heal. I also read later, last year or the year before, I can't remember, I think it was last year, was when Professor Moncrieff came out with this incredible book called Chemically Imbalanced. And this is based on her research. She led the research team that did a thorough study of all of the studies that have been done on the chemical imbalance theory over the past couple of decades. And were able to identify that the chemical imbalance theory has been completely disproven. There was no foundation for this theory in the first place. It was a theory that they came up with to try and justify the use of medication. And doctors continue to use this assertion that there is a chemical imbalance. And when she talks about it in chemically imbalanced, she's talking specifically about the serotonin theory, which is talking about depression. But it is the same theory that is used to talk about, bipolar disorder, anxiety disorder. All of these disorders are touted to be chemical imbalances, and they have never been proven. In fact, every time they go to try and prove that there is a chemical imbalance causing these things, what they actually end up showing is that the chemical imbalance didn't exist before the medication was taken, but the medication causes a chemical imbalance in the brain. As I did more research, I started looking at myself, at the experiences that I'd been through myself, and the sources of the symptoms that I had discovered. The very first one, obviously, was medication. Medication itself caused a chemical imbalance. It changed my brain chemistry. It made things worse, caused all kinds of problems for me that led to hospitalizations, electroconvulsive therapy. But I started to wonder how the micronutrients differed. Because once I started understanding what the medications were doing, I thought, well, I don't know, that doesn't seem to be the case for the micronutrients. So I started doing more research about micronutrients. And I actually had the privilege of interviewing Dr. Bonnie Kaplan she's, again, one of my very first interviews was Dr. Bonnie Kaplan. And she wrote the book, The Better Brain, along with Dr. Julia Ruckledge. And The Better Brain is an incredible book that talks about how the increasing rise of, the dramatic increase in mental illness that we are seeing is largely related to the fact that our society is so deficient in micronutrition. Our food supply has been stripped of most of its nutritional value. Our farming, we are doing mass farming now, and so the nutrients in the food are significantly lower than they were, 50 years ago. We are getting food from other countries. I did an interview a couple of years ago, I believe, with a farming expert who talked about how as food is transported from the other side of the world, they have to pick it way earlier than it should be picked, which means that it doesn't have time to ripen. It doesn't have time to get all the nutrients in it. In fact, there are things in the fruits and vegetables that leave them as they ripen that are still there, that lower the nutritional value and can cause problems. So they call it food miles. So the further food has to travel to get to you, the lower the nutritional value. So there's all of these things that have affected our food supply, and we eat way more processed food now than we ever have in the past. So our food supply has significantly decreased in its nutritional value, which has correlated not just with physical health effects, but mental health effects. Our brains are not getting what they need through our diet to function in a healthy way. And this book is so phenomenal. When I went through the research in this book, I read it a couple of times, and then I had like I said, I had the honor of interviewing Dr. Kaplan on my show. And then I've interviewed David Steffen, who is the vice president of True Hope, which is the micronutrient company that I use and that I recommend. And I recommend them I don't get any financial benefit from recommending them. I've been very clear about that. They are a nonprofit out of Canada that was started specifically to address bipolar disorder. And as they've done research on it over the years, they've discovered that it also helps with ADHD symptoms, depression, anxiety, because all of these mental illnesses that we're seeing, one of the main sources of the symptoms is micronutrient insufficiency. And as David Steffen talked about when I interviewed him recently, I believe it was in episode 71 was when he talked about this specific item. There are 4 building blocks of the neurotransmitters in our brain, which are responsible for emotional response: vitamins, minerals, omega-3s, and amino acids. And if you are getting insufficient levels in any of those, your brain will not have the building blocks that it needs to create those neurotransmitters in healthy levels. And so we end up with our brains not being able to function in healthy ways. And it's just because our diet is not getting sufficient nutrition. Our brains are not getting sufficient nutrition. And one of the other things that they talk about in the Better Brain is that there are genetic predispositions to require higher levels of micronutrition, which is why you see generationally within families, people displaying the same symptoms. Their brains are not getting what they need to function in a healthy way. As I continue to learn more about like sources of symptoms, I also learned about the sources of symptoms that come from trauma. And I read The Body Keeps a Score by Bessel van der Kolk. And that was so eye-opening to me because I, for a long time, believed that my bipolar had been triggered by trauma, but I thought that it was triggering a disease because I believed, again, what I had been told by the expert, that, the experts, I should say, that I had a chemical imbalance. And I believed that what I had been told that trauma can trigger the disease. And the interesting thing is that the trauma is causing symptoms, but it is not triggering some kind of disease. It is triggering a trauma response in somebody. And if you can address the underlying source, if you can identify the trauma and use trauma-informed modalities like EMDR and somatic therapies and IFS, which is internal family systems, or rapid resolution therapy, you can actually resolve the source of the symptoms. You can resolve the trauma, heal the trauma, and resolve the symptoms. You have not triggered a disease in your mind. It is the brain's response to trauma. The symptoms are the brain's response to trauma. And then I continued to do more research, and I had started using a lot of these treatments already, not fully understanding what they were. I didn't again, like I mentioned with the micronutrients, the Empower Plus from True Hope, I didn't understand what it was doing in my brain. I was just desperately looking for something that would help me manage my symptoms better. And it worked, and so I kept taking it. But I didn't really understand what I was doing. I didn't understand what it was giving to my brain. I didn't understand when I was seeking therapy that I was actually resolving the sources of my symptoms. When I finally found a trauma-informed therapist, when I finally found, for me, I used EMDR, and I used some somatic therapies, breath work and yoga, that helped to resolve the underlying sources of the symptoms, helped me to heal the trauma, which resolved the symptoms. And then I had also been using mindfulness meditation, which was a huge game changer for me. When I very first was introduced to mindfulness meditation, I was working, I had been introduced to it through Jon Kabat-Zinn, who is considered the father of Western meditation. And I've talked about him before on my podcast. And I could feel that it was helping me, but I couldn't meditate for 45 minutes a day. I was a mother with young children, and I didn't have the ability to block out 45 minutes a day to meditate. And when I bought his book, it was more than I could handle when I first bought it. It's called Full Catastrophe Living, and it's a fantastic book. But I couldn't, at the time, I couldn't read a book that thick. I didn't have the ability to concentrate that long, and nor did I have the time or desire to do it. I didn't really want to do that at the time. But I found Mindfulness, an 8-week plan for finding peace in a frantic world by Mark Williams and Danny Penman. And again, I've had the privilege of interviewing Dan and Penman twice on my program. And that was a game changer for me. They broke down why mindfulness helped, what it is actually doing for the brain, how it is helping you regain the ability to manage what's happening by just learning how to stay present. When we pathologize these symptoms, when we treat them like diseases and call them diseases and believe they're diseases, when we believe that mania is a disease and depression is a disease and anxiety is a disease, it takes the ability to do anything about it out of our hands. We don't have control over what's happening. We become victims. But when you recognize that symptoms are information, it's the brain's way of communicating, and you learn how to stay present with the symptoms and stay present with the emotions and look at them with curiosity, without judgment, with curiosity, without judgment. You can look for clues. You can become a detective in your life. And that is one of the things that mindfulness meditation did for me, is it helped me become more self-aware, helped me learn how to stay present with discomfort instead of trying to escape it, look at the symptoms with curiosity over judgment. And then that helped me start identifying the sources of the symptoms, which helped me become more effective in treating the sources and resolving the symptoms. I have not gone to college yet. I'm actually in the process of applying for an advanced degree, because I do want to turn this treatment approach into a replicable treatment modality that can be licensed and used in clinics to help other practitioners use this to help people heal. But no, I don't have letters behind my name right now. I have a brain. I have the ability to read research and understand it and apply it. And I have applied what I have learned in my own life, and it has helped me to heal completely. I have resolved the sources of my symptoms, and I help other people do the same thing. And as I have done this research, as I have read these books, as I have learned about the history of psychiatry and the truth about psychotropic drugs from people with letters behind their names who have done the research, who were doing it with in an unbiased effort to understand what they had been taught, I learned the truth, and I started to understand that I had been misled when I was told that I had a chemical imbalance. I had been misled when I was told that I had bipolar disorder. I don't even like using that term anymore. It is a meaningless term that turns people into victims, as I've mentioned on previous episodes. Yes, bipolar symptoms are very real. And yes, they can be very scary. I do understand that there are times when somebody is a danger to themselves or others, and they might need medication temporarily to help them get back to a stable place so that they can then start working on healing. But medication and diagnosis should not be the long-term solution. None of these drugs have been tested for safety for long-term use. Our brains were not designed to be chemically altered permanently. That is not the natural state of our brains, and it is not healthy for our brains. It is important for us to make sure that we learn how to trust ourselves. When we say trust the experts and give them our blind faith, we put ourselves at risk. I would love it if we could just trust the experts. That would be amazing. But the experts in the psychiatric field are being taught from curriculum that has been written by psychiatrists who are paid by drug companies. There's evidence for that. That was one of the things that made me the most angry when I read The Anatomy of an Epidemic. So it's critical that you do your own research. Don't trust me. Don't trust the experts. Trust yourself. Do the research yourself. Read about it yourself. I will link all of these books in the show notes, and I encourage you to begin learning yourself. I would encourage everybody to start with Anatomy of an Epidemic. That was so eye-opening to me. It helped me to realize that a lot of the intuition that I had over the years about what was going on was spot on, but I didn't trust myself because I had been conditioned to trust the experts. I want to invite you to learn for yourself. You can start with my book if you want to just learn about my own experience. I list all of the research in there that I used that helped me to learn about each of those tools and how they can be effective in helping to treat different underlying sources of symptoms that leads to healing. And then if you're so inclined, you can start reading these books for yourself and learn for yourself the truth about these symptoms and that they can indeed be resolved. I would love to hear from you. If you have any comments or questions, please send me an email. My email address is linked in the show notes. If you haven't started your healing process and you think you're ready to get started, send me an email and let me know. If you haven't developed a mood cycle survival guide for yourself, make sure you go in the show notes, click on the link and get your free mood cycle survival guide that will start you your first step to healing and recovery. I hope that you will learn how to trust yourself, learn how to do your own research, learn for yourself the truth that will set you free. Until next time, Upsiders.